Imagine a world where a simple cut could be lethal, where routine surgeries become death sentences, where a common flu could spell disaster. This is not a dystopian science fiction plot or scaremongering. It's a potential reality in 5 years if antimicrobial resistance, or AMR, continues to rise unchecked. In the hushed corridors of our hospitals, healthcare professionals nervously grapple with fear of getting infected, a growing menace worldwide. Dr. Kadiali Srivatsa, the superbug maverick, who spent more than 40 years studying publishing articles about superbugs, said in Sky TV interview in 2014, "This is not a threat to humanity, but a threat to our very existence." We witnessed death of more than 10% of healthcare workers during Ebola epidemic in West Africa in 2015.
System is where sick people go. Especially in countries like in India, healthcare workers are actually in short supply. These are precisely the areas where we can't afford to lose them. If we can't protect our healthcare workers, everyone is going to suffer. Who will take care of the patients?
More than 50% of people who died were healthcare workers. The implications for public health are profound, but lives of doctors and nurses are at stake, he warns. Meanwhile, in the pristine labs where battles against microscopic foes are fought, scientists echo the same concern. AMR is like a ticking time bomb, says Sally Davis, the Chief Medical Officer of UK. In a decade, if left unchecked, we could see our healthcare system crumbling under the weight of untreatable infections. Fast forward another 15 years and the world could become unrecognisable. The bustling hospital wards, the thriving cities, could morph into deserted relics of a bygone era. Dr. Ben Park, Director of CDC Infection Prevention USA, voices this chilling vision. If we don't act now, AMR could take us back to the pre-antibiotic era in 5 years, a time when simple infections are fatal, he cautions. The message is clear. The future of healthcare hinges on how we address this rising tide of antimicrobial resistance, and the time to act is now. In a webinar organised by CDC, 5 decision makers were silent when asked how they plan to avert the crisis.
If you were in the position where you were the policymaker and you had both the political will and the dollars that we have for COVID and could bring them to bear for antimicrobial resistance, where would you start?
I can take that, Michael. I think that it's obviously not easy because there's a lot of things that one could really focus on. But I think one thing that is underappreciated is really the role of vaccines. And these are not necessarily new vaccines, it's vaccines we already have, which have the capacity both to reduce illness from viral pathogens for the most part, but also reduce antibiotic consumption. But we should also invest in antibiotics for bacterial pathogens, which are more difficult. But if COVID has taught us anything, it is that if the world puts its mind to solving those kinds of problems, then the money flows and it's possible to make happen. I think issues like water and sanitation will take a lot longer because that can't be solved in this kind of, in the lab reflexive mode. And I think IPC is somewhere in between. So vaccination is where I'd place my highest bet. And then on the IPC, infection prevention and control, and then on the water and sanitation in that order. Because the reasons to solve water and sanitation are far beyond just AMR. There are many other reasons to go ahead with it, which includes just diarrheal pathogens and so forth.
Yeah, hi, Michael. I can go next. I think one of the key things to think about is how do we prioritize problems and how do we prioritize solutions? I think AMR is certainly a very complex problem, and I think it was Ramnan that brought up the analogy to climate change. I think AMR is somewhat akin to that, in that policymakers often see AMR as a very complex, highly technical problem. And I think in order to kind of break through that confusion, it's important to prioritize the problems and prioritize solutions, but not just prioritize the solutions, also develop real solutions with real targets that can be tracked and we can have accountability around achieving those deliverables. I think that's going to be very important to demonstrate that we can make progress. And I think it's going to be important to show what happens when we do make progress.
All that they said was fuel research into new antibiotics, vaccination and diagnostic tools. We must champion responsible antibiotic use in both human and animal health. We have to invest in infection prevention and control measures, and we must enlighten the public and policymakers about